We begin our discussion on parathyroid gland. So first we discuss the surgical anatomy. Before moving to the surgical anatomy, something of historical importance, it was first described by Sir Richard Owen in neck dissection of Indian rhinoceros. Coming to the surgical anatomy of the parathyroid, we need to understand the development of the parathyroid gland. So, these two are the superior parathyroid glands, and these two are the inferior parathyroid gland. The inferior parathyroid gland develops from the third pharyngeal pouch along with thymus, and it has a long embryological descent as a result of which it varies in position. The most common position is on the lower pole of thyroid. On the other hand, superior thyroid gland, it develops from the dorsal portion of fourth pharyngeal pouch. It has a limited embryological descent, as a result of which it is more constant in position, and the most common position is at intersection of inferior thyroid artery and recurrent laryngeal nerve. The importance of location lies in the fact that this could be injured in the surgery procedure of thyroidectomy. Hence, it is very important to know about the location of this parathyroid gland. Now, here is an image which has been taken from Bailey and Love. The first image shows about the inferior parathyroid, where it's seen that the most common location is related to the lower pole of the thyroid, which is around the 56%. And in case of the second diagram, which shows about the superior parathyroid, it can be seen that the most common location is around the intersection of the inferior thyroid artery and the recurrent laryngeal nerve, which is around 77%. Now, to wrap up the surgical anatomy, few times a question have been asked regarding the weight of parathyroid gland, which is around 30 gram. They appear as golden yellow brown, refers to as Portland brick, and the blood supply is from the inferior thyroid artery. So, the surgical anatomy by Richard Owen in Indian rhinoceros, the superior parathyroid gland develops from the dorsal portion of the fourth pharyngeal pouch, whereas the inferior parathyroid gland develops from the third pharyngeal pouch along with the thymus. The most common position in the case of inferior parathyroid is the lower pole of the thyroid, and in case of the superior is the intersection of the inferior thyroid artery and the recurrent laryngeal nerve. The blood supply is from the inferior thyroid artery, and the weight is around 30 grams.